So we've had a few people contact us during the lockdown period who have injured their back, maybe doing a bit more DIY, and something's gone ping, they can't move, they're in a panic. So what can you do with acute back pain? Well, a couple of things to note for starters. 80% of people will have an episode of acute back pain at some point in their life, so it's really common, and 80% of those cases will resolve within 6 weeks, if not earlier. Most causes of back pain are mechanical, which means there is soft tissue damage like muscle or ligament strain or muscle spasm rather than something really intense. And back pain can come on really significantly, but it doesn't necessarily mean that there's a significant amount of damage. So what can you do? Well, for the first 1 to 3 days, that's when most of the inflammation kicks in for any kind of injury. So when the blood flow takes all the goodness to that area and helps with healing. So it's important during that phase not to push things too much, to do things that don't flare you up. That doesn't mean lying on the bed for a week and not moving. Most people will find that won't help. Relative gentle movement is great. So little things like going for walks, things that don't flare you are really good. Stretching is important. We'll put some stretches that can help up on our Facebook page. And really important to note, stretching shouldn't be increasing your pain. So it should help to just get the body moving again and help move the muscles, which reduces inflammation and brings blood flow to that area. Heat can help. It won't speed up the healing, but it can be comforting during that time when you're in a lot of pain. Most back pain improves over time naturally. So if you were to see us in the clinic at the moment, we wouldn't be doing heaps of full-on hands-on therapy over that first week anyway, so it's great if you can manage it yourself during that period. And if your back pain hasn't improved over the course of 6 weeks with those treatments, then you want to be seeing your doctor and seeing if you can get something like anti-inflammatories. But the inflammation process is important, so if you can, let that run its course. If you did have pain in your legs, any weakness, any bowel or bladder problems, or numbness, then that's more serious and we want you to see a doctor or come and get in touch with us for that. Alright, stay healthy.